gaps.
All right, welcome everyone. I'm Rob Tatro, President Founder of the Canadian CMV Foundation. Another great edition of the CMV Checkup. I am thrilled to be here today. We have a pretty unique and exceptional guest, one of the guys I respect the most that's you, Dr. Brophy. Really, this guy is so busy and does so much work for infectious diseases. Right now, he's doing a ton of work on the COVID side. But as far as I've known him since the beginning, he's been an extremely strong advocate for CMV and for the CMV community. I'm thrilled to have him. I'll introduce you right now, Dr. Jason Brophy. Welcome to the show, and thank you for being here today.
Thanks, Rob. Thanks for having me.
Yeah, when would we have met? We would have met, like, I want to say Austin, perhaps, or maybe Salt Lake City.
I think
Burlington.
I can't even
one
remember.
Of the
one of the many conferences where you're a fixture.
Yeah. So you've been extremely busy right now, and I know you what I'd like to chat about today, before we get into kind of what you're doing, your kind of history with CMV, some of the research you're working on, what CMV means to you. I do want to let our viewers know, first of all, if they're watching on YouTube, they should subscribe to our channel. If they're watching on Facebook, they should like and share. Give us your questions right now. If you're watching this, you're a parent, or you want to know something about, infectious diseases, we will do our best to get you an answer from Dr. Brophy or me. But I doubt I could help. But if I can, I will try to help. So, ça c'est ma fille, Aubry. Yeah, she's helping me out today. And she's distracting me a tiny bit. But regardless, also, we want to talk about Ottawa 2020, which is coming up. Ottawa 2020 is going to be the conference that's coming up. So you guys knew about the Pediatrics Infectious Disease Conference that's coming up. We have Monday, August 31st. We're going to be doing a live. All right, let's do this. We're going to be doing a live webinar cast for the Canadian CMV Foundation and for the Public Health and Policy Conference. So on Monday, August 31st, Dr. Gail Demler-Harrison. So she's done a ton of research on CMV. So that's at noon Eastern time. September 1st, we're going to have Kara Gluck, Making a Difference Without Legislation. On Wednesday, we got Sandra Rosendahl, Emily Grotman, and Whitney Wunderlich. They're from Minnesota hospitals. They're going to talk about experiences in universal screening and newborn saliva collection. Thursday, September 3rd, we got Albert Park, cross-sectional survey of evaluating awareness of congenital CMV. And finally, on Friday, September 4th, our Canadian superstar, Dr. Pranesh Chakravorty, hopefully I'm pronouncing that right, Ontario Universal Screening. So really thrilled, excited that is coming up. That is coming up in about, a month, give or take? So that's exciting. That was supposed to be in your hometown, Jason. You're in Ottawa. How's life in Ottawa these days?
Life in Ottawa is a little consumed with COVID-19 and all of the craziness that's followed that. And so it's unfortunate that it's kiboshed the original plans for the CMV conference, but that lineup you just talked about sounds great. I think no one will be disappointed there.
Yeah, so we're going to do daily shows at noon Eastern from the entire week that the conference was supposed to happen. So Monday, August 31st, all the way through Friday, September 4th. It's a who's who of speakers. We're really thrilled to have them. They'll be giving a talk. It's going to be fantastic. I'm excited. I'm co-chair of the Ottawa 2020 Public Health and Policy Conference, which is now the Ottawa 2021 Public Health and Policy Conference, because as you know, we've pushed it back a year, but it's a bit of a superstar lineup. And after that, we'll be doing bi-weekly. So every 2 weeks, we'll be doing an ongoing momentum where we're going to be getting speakers that are going to come and chat about CMV. So we're going to have some abstract presenters. We're going to have about 10 or 12 of them. Really, really thrilled to have that. So that's going to be every 2 weeks. So stay tuned, follow our Facebook page, follow us on YouTube, specifically our Facebook page to get more information on that. Dr. Brophy will do our absolute best to get you on that if you can spare some time. So maybe you could start and tell me how you got involved in CMV.
Great. So I'm as the byline says, I'm a pediatric infectious disease specialist practicing here at the Children's Hospital in Ottawa. And I was really lucky to be invited to take part in the planning for the launch of including CMV as part of the newborn screening program here in Ontario, because the Newborn Screening Ontario program is based here at my hospital, CHEO. And so Dr. Chakraborty that you mentioned will be in your lineup of speakers. He's the lead of the Newborn Screening Ontario program, and he's a metabolic specialist, which is the majority of what's screened for in newborn screening. But he invited me as a content expert around infections and congenital infections in particular to take part. So it was really fortuitous. It was an interest of mine already, but I got to be part of what turned out to be really groundbreaking new program that has everybody in this field excited around the world, and justifiably so. We're quite excited.
Yeah, I can't emphasize that enough. If you don't know, if you're just watching this and you're not sure, this has everyone on the entire planet excited. We get emails from people around the world that are thrilled of the work that you guys are doing in Ontario. The universal screening is actually the first place, and universal screening, to clarify, means all babies. I mean, all babies, pretty much all babies, right? They are being screened right now for CMV, and obviously if there's follow-up done and there's potential treatment and there's opportunity to follow up for hearing, and it's just such a remarkable accomplishment, and you guys got it done in Ontario. What's the story there? How did it happen, real quick? And then I want to talk to you about your research afterwards.
Yeah, so it was Dr. Chakraborty's own brainchild, where he had been working with the infant hearing program here in Ontario, who have a screening program for children at risk for hearing loss. But they realized that one of the biggest risk factors for hearing loss, they weren't actually screening for, and that's congenital CMV, because the majority of kids with that problem, with that infection, are never diagnosed until much later if they develop complications, if at all. Sometimes it wouldn't even be recognized. And so they realized that they could do some screening on the newborn dry blood spot, which would allow us to pick up these kids earlier and earlier, and potentially be able to offer treatment for those who are already symptomatic in the newborn period. And so together, infant hearing program, which is under one ministry in our provincial government, and the newborn screening program, which is under the health ministry in Ontario, work together to launch this program. And so it's really a hearing initiative to identify an infection that can cause hearing problems. So it's really quite ingenious, because most other programs have tried to come at it from identifying the infection, and this really comes at it at the back end. Like, what are the effects of this infection? What can we do to reduce those potential impacts? And what can we do to reduce the impacts of hearing loss generally? So it's really smart.
Yeah, so creative how you guys figured that out. So congrats, hats off. We will get Dr. Pranesh on September 4th. So make sure you tune in for that. He'll likely tell that story as well as others. You've done, so obviously you work in, your terminology I'm never going to be familiar with, because I've never gone to med school, and it's never too late. Maybe someday, but don't do it.
No, it is never too late. And
okay.
If anyone could do it, it'd be you.
So you do clinic work, correct? So that where you actually work with patients, and then you also do research as well. So maybe tell me a bit about your research, a little bit about some of the stuff that you have worked on, or you'd like to work on, or
yeah, sure.
I know you've got some interesting stuff happening, and one of the most interesting is definitely going to be the dried blood spot versus. I'm stealing your thunder here, but regardless, stuff that you're working on.
Great, thanks. So there are a few things that we are working on. One is to try and review the cases of congenital CMV that we've had here through our program, and what are they looking like? Because this is the first of its kind in the world in terms of a universal screening program, we're really interested in describing those patients, those children, and how they present, because all of the literature that's out there, it's almost all piecemeal people who are identified because of symptoms or because their mother had a recognized CMV infection in pregnancy. And so really, what does the general population of kids with congenital CMV look like. One of the things we're really keen on understanding is, are there risk factors for hearing loss or symptomatic CMV that we can identify early? Like if 10 to 15% of asymptomatic children with congenital CMV are going to develop hearing loss, is there some way we can flag them or identify them when they're born that's going to allow us to follow them differently, or potentially offer them treatments differently than other kids?
So like, for example, if all the babies who eventually become symptomatic are allergic to raspberries, well, that would be a great thing to know, because then you could check for raspberry allergies, and then you would know that there's a higher likelihood of them, something like that. But obviously not raspberries, but something like that.
Yeah, no, exactly that. And so we're hoping to be able to do that over time through more detailed follow-up of these kids. And then the last thing that we're interested in is it's kind of feeling a little greedy, but we know that we're doing screening for CMV on the dry blood spot, but we also know that that might not be the most sensitive way of looking for it. And so we're keen on looking at other ways of diagnosing CMV in a universal program, such as saliva testing or such as urine testing, so that we actually pick up even more, because the sensitivity of the test isn't totally clear, of the dry blood spot testing isn't totally clear. And if we did a better test, that means we're going to miss even fewer of these kids. And so we're very keen on understanding how to do that, and is it cost effective, meaning where the money we're spending on the program is going to get us more bang for our buck.
I know that Dr. Fatima Kakar, who's going to be on the show, I believe in August, is working on some sort of research, a pilot project or a research project on urine versus saliva screening. So that's really, really interesting. I remember her telling me they're one of the only places that do kind of a lot of urine testing, I believe, for CMV babies, if I'm not mistaken.
Yeah, so in different hospitals across the country, they have their own special CMV screening programs, like in Vancouver, like in Montreal at Hôpital Saint-Justin. And so they're each doing their own specific way of doing things. And I think by pooling all of our research experience together, programmatic trials and tribulations together, I think we're going to understand much better how to lick this.
Yeah. So congrats on all that work. We're thankful. I'm incredibly thankful all the work you're doing. The parents are thankful. By the way, if you're a parent and you're watching and you'd like to get involved, you'd like to, maybe you're in New Brunswick, right outside of Miramichi. What's it called? Blackville?
Yep.
Blackville.
My hometown.
Your hometown, or maybe you're from Marchand, Manitoba, my hometown, and you're a CMV parent and you're thinking, I want to get involved. There are multiple ways to get involved. Please go to our website, sign up for our newsletter, reach out to us. We are doing we want to connect with as many parents as possible. You could share your story with us. You can get involved. You can do a fundraiser. You can raise. You can contact us at info@cmvcanada.com to find out how you can help. Trust me, we need your help. We can't do this alone, and I'm thankful to all the parents that we have met and that are helping out. So on that note, Dr. Brophy, you've gotten involved. You've decided at some point that you would decide to get involved with the medical advisory for CMV, the medical advisory committee, or the board, if you will, for CMV Canada. You're so busy. You do so many things. Why did you think it was important to get involved with the work that CMV Canada that we're doing? And why did you choose to get involved?
Well, a few reasons. One is you're a hard man to say no to, but you also have a really good selling point, which is I think that this is a completely under-recognized and underappreciated illness in Canada. For almost every family whom I've met whose child has congenital CMV says they've never heard of it. And how could they have never heard of something that's so common? Because we know that around 0.6 to 1% of all babies are born with this infection, and 10% of those are going to have complications of it. 10 to 20% are going to have complications of it. And so how can they not have heard of this? I totally agree. And I think the work that your foundation is doing is really raising the awareness and providing the support that parents really need. Most of them feel so alone because it's something they never heard of, and how can their baby have this, and what can they expect from that? And almost every family I've encountered has some variation on that statement. And so I think CMV Canada's work is so important in that way, not only to support families, but also to advocate to provincial governments to increase coverage and appreciation and diagnosis and treatment and all of the things that are necessary for this condition.
And on that point, we are going to win, Jason. We are going to win. We're going to, through the work of families, parents, and experts like yourself and the pediatrics ID specialists and ophthalmologists and ENTs and obstetricians. We're going to reach and we're going to change how the current protocol is, because it straight out does not make sense. And it's ridiculous that we have a #1 cause of infant disability. No one's ever heard about it. No one's even being screened by it. You can identify these babies at birth. You can potentially treat them, and you can not only improve their outcomes, but you can dramatically improve the emotional quotient or the emotional outcome for parents. So we as parents deserve to know. We should have a right to know. It should be basic standard of care, and we're advocating for that, and we will win, Dr. Brophy, on that. So thank you for agreeing to that. We've got some questions here from some parents, through the parents that we know. They're asking me your thoughts on COVID and COVID with respect to CMV. Are there any connections? Are they just straight up two completely different diseases? And I'm kind of ambushing you with this question here. I know I didn't tell you I would ask you this, but some of the questions are coming through on my phone, and I just thought I would ask you that question.
Sure. I mean, to our knowledge at this point, there's so little known about COVID in general, it's hard to say with confidence. But to our knowledge, there isn't any clear connection between COVID and CMV. Although I do wonder if we're going to see fewer cases of CMV as a result of kids not being in daycare for such a prolonged period of time. So we know
kids
we
not
know
being in daycare and
or school
and people washing their hands and kind of all the stuff that we're talking about, to help prevent the spread of CMV, as you're seeing on the ticker right now. Wash your hands frequently, avoid sharing food or utensils, wash surfaces often. This is what we're doing through COVID, right?
Yeah. So I actually wonder if we will see a reduction in infant infections, because for those women who would normally get CMV from their child who's in daycare, which is like the most, I think, the vast majority of kids that I've seen have the same story, where they have an older 2-year-old sibling who's in daycare, and that's most likely where the infection would come home and infect the mom. And with kids being at home and daycare is shut down for such a prolonged period, and as you said, people being appreciative of the importance of hand hygiene and the importance of not transmitting infections, that maybe we're going to see some side benefit of this COVID craziness.
I'm convinced that we will see. I've talked to a few different pediatrics ID specialists, and I've had different opinions on that, but I am convinced that we will see a reduction. And obviously I have 0 years of medical training background, so that's a pretty valuable opinion. No, I don't know what I'm talking about, but that's a very good point. So, we don't know exactly. Now, what about the future of CMV research and CMV awareness and all the CMV momentum, given what's happening with COVID? Because I imagine you, as a pediatrics infectious disease specialist, your time is completely devoted to infectious disease, which is COVID, right now, I would imagine, right?
A lot of time is being devoted to that. But it's interesting to me, because the same thing happened a few years ago with Zika infection. Like the world was on fire thinking about congenital Zika. Think about it, a viral infection that can infect women in pregnancy and cause their babies to have small heads and cause their babies to have other complications. And what can we do to prevent it? And can we develop a vaccine? There was a huge amount of interesting momentum around it. And those of us working in the CMV field were saying, we already have an infection that causes that, and way more numbers, and where's all the attention on this much more common problem? So I think that's the nature of infectious diseases, and there's always interest around the newest thing, but I think we always need to come back to what's important and what's common and what's preventable or treatable, or where are knowledge gaps. And I think CMV needs to have its day to and I'm hoping that it's coming.
Yeah, the number one cause of infant disability, the number one cause of non-hereditary hearing loss in babies in North America. So many babies are impacted by it. We've met so many parents. If you are a parent out there, please reach out to us. We'd love to hear your story. Dr. Brophy, we're running low on time, so I do want to thank you for your time. Anything else you'd like to add with respect to either your experience with CMV or what you're seeing kind of now in the field, or any kind of parting comments for our viewers?
Yeah, I mean, I think the one thing I would say is talk to as many people as you can. It really breaks my heart when I see families who say they've never heard of this or feel like they could have done something to prevent it. And so I think we all need to do our best to share the information that we have, share best practices, call out professionals who don't know the best practices and what they should be doing, and really bang the drum, because we want more and more people to appreciate the importance of this and move the field forward and help more and more kids like you guys are doing.
I do believe that 2020 is the tipping point, or the TSN turning point, for those of you that are sports fans in the CMV space. We got universal screening happening in Ontario. We got multiple other provinces that are looking at universal screening. There's targeted screening already in multiple hospitals across the country. People are starting to listen. Corporate sponsors are coming on board. Parents are getting on board. I'm extremely thrilled and pumped about the momentum that is happening. It's too bad we didn't get Ottawa 2020, but that's okay. We're going to get Ottawa 2021, and it's going to be fantastic. Don't miss the CMV Public Health and Policy Conference webinar series starting August 31st, September 4th, noon Eastern. Follow at CMV Canada on Instagram, Facebook, and I guess YouTube, and the social media stuff. Follow us on there, and we'll definitely update you with what's going on. If you're watching right now on YouTube or on Facebook, please take a second to share, to like. And once again, thank you to Dr. Brophy for spending the time today. I know you're incredibly busy. Probably every time I talk to you, it's crazy how busy you are right now. So I'm thankful that you took the time to share your thoughts, your opinion about CMV. And I'm going to wish you a great day. And thank you all for viewing. Stay tuned. In August, we got our next show, and I believe it's Dr. Fatima Kakar that we spoke about that will be on. And we're also going to have a bi-weekly, so every 2 weeks, we're going to have a special ongoing series about the CMV Public Health and Policy Conference. That's going to run right through September all the way to February. So a lot of activity coming up. Make sure to follow us. Thanks so much, Dr. Brophy.
Thanks for having me. It's a pleasure.
You have a great day.